Hello, everybody. Welcome back. And today I want to talk to you about some of your other post-adjustment rehab exercises that we have you do that we haven't yet talked about. So obviously I want to talk to you today about seated neck traction, and then in a moment we will move and talk about lumbar traction as well. Now, traction is a very effective both warm-up exercise and a rehabilitation exercise. When we have you do it when you are warming up, it's more or less to pump fluid in the discs, warm up the soft tissues of the cervical spine, and to prepare you for the adjustment, as well as to help formulate a more cervical curve into your neck. Now, when we use it here with the seated neck traction, that is primarily what we are trying to do. We are essentially forcing the good curve into your neck, because if you're doing the seated neck traction 9.5 times out of 10, I'll go out on a limb, 9.5 times out on a 10, you have a bad cervical curve or there's ligament damage in your neck. Okay, so most effective way to do this is literally a weight pulling forward on your neck and a weight pulling your head back. So the correct ratio to this is to have the weight in front of you twice as heavy as the weight that is on your head. Again, if you don't do this exercise and you think it might be a good one for you or you would like to try it, please discuss that with your doctor first. Please do not try to do this on your own. I will openly tell you that this exercise is the one that is most frequently and commonly done incorrectly by patients who have been properly trained on this. So if it's something you like to try, make sure you're a good candidate and discuss it with your doctor first, please. So when we start people on this, we start them with the lowest weight amount possible, as well as the short time to get you used to doing this. Again, what we're essentially trying to do is force the good curve into your neck, but we're also trying to rehabilitate any damaged ligaments in your spine, which can occur with injuries such as whiplash or having a motor vehicle accident or even a very serious sports injury. So essentially the same thing as we're trying to do with the low back traction as well, but that's more of a passive therapy. And so essentially what we're trying to do is that we'll use that one a little bit more with someone who is in pain when they first show up, because it's not actually a weighted traction, and we are helping force some of the good curve into your spine, but it's more passive because we're allowing gravity to act on that. Now, one thing that does mirror the traction that we have you do are the rolls that come in your kit. So those are going to help passively put good curve into your spine while you sleep, and it allows gravity to act on you. Now, the blue ones, again, they're softer. They're for you to get used to lying on them. The gray ones are going to be more firm, and they're actually essentially to help you force and put more good curve into your spine. So as soon as you've been able to lay on the blue one, so where we say for a minimum of 20-25 minutes, you're then ready to move up to the gray and essentially start building your curve, which is going to be better for you. So I have one comment. Let's see. Yeah, Lalo says he always feels great after having done the neck traction for 5 minutes, and I agree. An actual CBP clinic, which is what we borrowed this from, they have you work up to doing this exercise for 15 or 20 minutes, and you're essentially sitting there like that for an extended amount of period to force that. So when you are doing one thing I did fail to mention, when you are doing the seated neck traction, whether your traction is straight or at an angle, it doesn't matter. When you have the weight on your head, you want to be looking up, because again, we're forcing that good curve into your neck. And I've seen people do this, and when they do it, they look like they're sitting up and they're essentially trying to fight the weight or trying to strengthen the muscles. Don't do that. Allow your head to go back and force that good curve into your neck. If when you do come out of the seated neck traction, if your neck does ache a little bit, that's normal. That's what we want. That is evidence that we are retraining those ligaments, or that you are retraining those ligaments in your spine and in your neck to essentially get them to be in a better shape to hold your cervical curve to where it should be. So if you guys have any other questions, feel free to drop a comment. Please drop a like, thumbs up, and hope you guys learned something. Have a great night. Take care. God bless.